Hi, Gypsies! Today we will be having Hank, Marissa, and Wendy from Cross Country Healthcare speaking about how nursing has changed as a result of COVID-19, as well as answer any questions that you may have. So I'm going to bring them up really quick. So here is Hank, and then I'm going to bring up Marissa and Wendy.
Thanks, Rachel, and welcome everybody. We are so excited to have you with us today. Marissa and I always cherish the opportunities that we have to get with fellow nurses and to talk about current events today. And we're also extremely honored today to have Wendi with us, who has decades of experience in travel nursing. So you're in for a great treat today, and we're just excited that you are with us and enjoying this time with us as well. Speaking of being excited, I'm excited to also share with you that at the end of our session today, we'll have some giveaways. So the question is, how do you win? How do you get the giveaways? In the comment section, if you can list what you have learned, what you've liked, something like that, the people who are behind the scenes helping us today will be selecting a winner, and we'll be announcing that winner at the end of today's live program. So let's talk about COVID and this pandemic that we are in, the pandemic that continues and will continue for a while. The unknown is still there about what the future looks like for us as well. So today it causes us to pause and to look back. What have we learned? What do we need to think about for the future? And what about today? How do we handle it? What have we learned? You know, healthcare and the healthcare workers certainly during this pandemic had challenges, certainly justifiable challenges. And we had heard from all of you working out in the field about these challenges, and you have shared these stories. Staff had to deal with a variety of issues that really affected them personally and psychologically. It's really taken a toll on all of us. Even the Joint Commission recognizes the issues within the healthcare professionals, and they've encouraged us to take some safety tips as well. You know, healthcare professionals, we are great at caring for others, but sometimes it's hard for us to pause and care for ourselves. So today we want to give you permission to care for yourself too. So that's why we believe it's critical for us today to take a pause and to encourage each other, our fellow healthcare workers, and recognize that we are a team collectively, and we support you, and we want you to know that we are here for you as well. You know, I want to share with you one of my favorite quotes that I cherish. It's one from Dr. Seuss. Yes, don't laugh, Dr. Seuss. It goes like this: when something bad happens to us, it can define us, destroy us, or strengthen us. And we believe this crisis has redefined who we are as healthcare professionals. And I think it has strengthened us as well. Look at what we have accomplished. We have cared for a nation during a national pandemic. We've been called heroes, and rightly so. Why? Because heroes run towards an emergency, not away. And all of you have been running towards that emergency, providing endless care. So what we share with you today is really not our story, but it's your story. At the beginning of the pandemic, we made a decision to establish a COVID hotline. And that COVID hotline was really there for us to answer questions, to be the advocate, to be someone that you could speak to listen to you. And today we've answered more than 6,000 calls to that hotline. So when I say this is your story, it's what we've learned, it's what we have heard. You know, one of the stories that really struck me one day when I was answering the hotline was a nurse that called who was very tearful, emotionally distraught. She shared with me in 9 shifts in the ICU that she's worked, she lost 12 patients. She had difficulty going to sleep at night because she still had images. And you know how we replay in our head, what could have we done different? Could the outcome have been different? And we listened to her and she told the story. So today, this story is about you, the heroes at the bedside. So let's get started. Marisa, can you maybe share with us some of your thoughts of what we've learned during this pandemic and maybe some of the experiences that you've heard from some of our colleagues out in the field?
Absolutely. Thanks, Hank. And I have to say, what a touching story. I know you and our entire clinical team answered thousands of calls and many similar to what you just shared. You know, I think it really illustrates the importance of a really strong support system. You know, look, this last year has been crazy so far. I mean, I can't believe it's been a little over a month when we celebrated the Year of the Nurse. It could not have been a more timely or impactful in light of the pandemic. And now, really more than ever, we need to recognize our nurses for their contributions, promote their health and well-being, which I know you'll talk about a little bit later, and really honor them for their sacrifices. Look, our mission since the onset of the pandemic has been simple. Go the extra mile, ensure our nurses have the support and resources they need when they need it. You know, and we understood that we were sending our nurses into an environment where they could be exposed or potentially get sick. Therefore, as you mentioned, we initiated the COVID hotline. We also covered pay when quarantine was mandated due to exposure or illness. And that was important to ensure that our nurses were protected and cared for during their time off so that they could get well and take care of themselves. You know, in addition to that, you know, we accelerated our hiring process. We knew that the demand was high, and so we flexed our credentialing requirements, created learning and virtual learning onboarding avenues, and were able to create and provide online on-site screenings upon arrival. You know, we actively explored new relationships with community partners, many travelers being able to take advantage of them, such as JetBlue, Hertz, and so many others. You know, so what trends did we really see during the COVID pandemic? Like many, we saw a surge in certain geographies, so New York and the Pacific Northwest, and in specialties such as ER, ICU, telemed surge. But at the same time, we saw a significant decline in other specialties such as OR, PACU, and L&D. It was really a bit of an imbalance across the board. You know, I think it was interesting for us to see a shift in demand for local services, for screeners, triage, and call center support, and telehealth services. You know, and many of these were even outside of our traditional healthcare settings. One last thing I'd share is that we also saw some of our travelers decide to stay closer to home, to work local contracts or pick up per diem versus hitting the road and being at the ready. With that, Hank, anything else, or Wendi, anything else that you would share as far as what we saw or the trends that you saw in your worlds?
Well, certainly, Marisa, I think that is it. It really caused us to pause and to look at things differently, as well as the clients as well, too, to take a look at it. I mean, I think it's been a wild ride is the best way to describe it. It has really caused us to really look at how we do things. It has reshaped us. It has transformed us. It has modified us. If you just think about all of us, here we are on this technology, how we communicate. How we work with all of you, how it's changed the business, how it has really changed healthcare for a lifetime. And it's been an interesting ride. And trust me, the ride isn't over yet. Nobody knows what the future holds for us as well. So Wendi, that leads me over to you. How about you sharing with us maybe what have you heard from the client side? What are you hearing there? And maybe as well as anything that you've heard from healthcare professionals out in the field as well.
Yeah, thanks, Hank. I want to pick up on what Marisa said. I think it's also important to note that in addition to some of the things that happened during the height of the madness, if you will, is that we're really working with our client facilities to make some of the changes the new norm. So looking at credentialing, how can we streamline that? How can we make that easier? online learning? How can healthcare facilities deliver their orientation without having to have you in big classroom settings? There's a lot of talk within our organization today about how we make that the new norm. So positives to come out of what happened over the course of the last couple months. But to what we're hearing from the clients, they're trying to balance, or they're balancing the unbelievable influx of patients, the acuity and intensity that they're seeing, and protecting their staff at the same time. So some of them have been through that, and now they're kind of looking at it and saying, what did we learn? And others are preparing for that. I think that there's a desire to think about what the triggers need to be for surge staffing. So what we saw and what we learned is that because no one knew, unprecedented times, hospitals were, I need X number of candidates here, talent here on this date. They over-ordered in some cases. They pulled the trigger too early. So looking at what should they be considering before bringing on incremental staff, and what does that look like? We saw cancellations as a result of some going too soon. We also saw some cancellations as a result of some hospitals bringing healthcare professionals on for a longer period of time than what was needed. So I think what we'll see going forward is a little more organized fashion in ordering incremental staff on onboarding, and as well as the length of assignments. I think we all understand a little differently. And then you have some facilities that have not experienced the surge that are trying to figure out what they would do in the event it happened, as well as how to prevent the challenges that they saw. So one of our clients is looking at having a designated facility for elective surgery, so that they can isolate that activity, continue to run and offer the services that are needed in the community while still caring for COVID if it's happening. So I think those are all things that we learned as we went, and we're better prepared. Obviously, non-traditional, Marisa mentioned that we're seeing different types of orders. So screener opportunities, contact tracers are starting to be a thing. Telephone triage, I think telehealth has changed immensely during this period, and will probably never go back to what that was before. So, looking forward, orders are up. We were at a real low point about 4 weeks ago, but we have had week over week increases in order count every week since. I think that as elective surgeries are coming back online, you also see patients going back into the hospital or going to the hospital for things that they put off because of fear and unwillingness to go. So as we move forward, there's this balance, right? Is finding our way back to a new norm, as well as being prepared and cautious about what's happening. Listening to the news this weekend, there's a couple hot spots. I'm in Florida. It happens to be one of the places that we're hearing that cases are up. And surely some of that is as a result of the number of tests that are being done, right? So the hospitalizations is what we're watching and what we need to be conscious of. Texas and Arizona are starting to spike. And I think that we will continue to see opportunities for care of very hot locations from a COVID standpoint, as well as demand and position counts coming back up in other places. Marisa, Hank, anything you want to add to that?
No, I think you hit it spot on, Wendi. I think that right now we're sort of in this sort of quiet period between where the surge was, several weeks, months ago, versus where we're heading with flu coming up. Right? All of us are asking the question: what's going to happen? Where are we going to be when flu comes into play and COVID is still potentially in a crisis state? And then what happens heading into next year with all the potential births, right? That everyone's planning for there to be a surge in L&D and NICU and PICU needs. So I think we're sort of waiting to see how that develops as well.
Mm-hmm. Yeah, I agree with those comments too, Marisa. And I think the other factor for our clients is all those patients who were out of the hospital during this period that maybe had a fear factor of going in. When do they start coming back, and how do we prepare for that surge? And what about ambulatory care, outpatient surgeries? What about the clinics? And also, what about respite time for their own core staff that needs a break? And how do we staff for that? And how do we prepare? The challenge is nobody, as Marisa kind of said, nobody has that crystal ball to say it's going to happen in 2 weeks from today. Because as those numbers change, as Wendi mentioned, and they fluctuate across the United States, it's going to be specific to a region or an area. So it's nothing that we've experienced. Usually when we have a public health emergency like this, it might be post, for us in Florida here, it's post-hurricane. And we kind of know how to manage that because most of us have been through several of them here. But to take that and to make that a national public health emergency, that's the challenge that we have, and our clients are having as well too. But again, in good partnership with them and our healthcare professionals, we need to be working together and be a part of the solution and to be a team as well too. As I said at the beginning, one of the things that we had heard time and time again on those 6,000 plus calls we have received to the hotline is the toll this has taken on healthcare professionals and the challenges that it has brought. So when you think about that, it really makes us take a pause to say, how are we ensuring our own care? How do we care for others? Nurses, we're good at caring for others. And we can give you all the things that you need to do. Sometimes it's difficult for us to apply them to ourselves. And especially during this time, we heard that time and time again. So, as the good rule is, it's kind of like as mama taught us, eat healthy, exercise, stay well, do all of those things. But really, I guess I would call it, how are we employing our stress management strategies? And you really think of it from a holistic standpoint, though. It's not only physical, but it's emotional, it's psychological, it's spiritual. And the stories that we heard from many of you out in the field is it impacted all of those. And how can we help you? And that's why that the hotline became so critical for many of you. And my staff came back and told me, I feel like that I'm just a listener. I'm a counselor. And every day at 10 o'clock, still going on today, the phone's still ringing today, we debrief from the day before. What can we do different? What needs aren't being met? How can we support you? How can we help you during this time as well too? The other thing that I heard time and time again from healthcare professionals is about how I needed to take what I call the micro break. And we've all been there where you have a difficult, challenging day, and I just need to step away. I need to take a breath. I need to recenter. I need to refocus. I need to rethink so I can come back and be fresh and new again to care for those patients. And sometimes families can be more challenging than the patients. But as you know, in this situation, the staff was the family. They were also the clergy. So they wore many hats. And when you were wearing that many hats and you see death at the rate that some of the staff was seeing it, it wears on you on all of those factors we talk about: psychological, spiritual, emotional, and the whole mental health piece as well too. The other thing that I always encourage the staff to do you have a buddy? Do you have a partner? Do you have a colleague that you can trust? Like Wendi and Marisa, if we're having a bad day, we can go in each other's office or we can Zoom each other and we can vent. And I know it's not going to go anywhere. We all need that. And especially in these times, you need someone to keep us in emotional check as well too, to keep us in a psychological frame of mind that we can vent, that we can talk to, that can give us some words of wisdom, some knowledge as well too. The other thing that our people struggled with, quite honestly, was the disconnect from family and friends. So think about it. Here you are in a national crisis. You're away from the family. You're away from your friends. You are required to do social distancing. I'm in an environment that's new with colleagues that I don't really know. And I'm a little homesick, quite honestly, as well too. Nothing more than the joy is, seeing the kids' faces. I have grandkids, to see the grandkids' pictures as they FaceTime and talk. So we encourage people, still stay connected as much as you possibly can. So important to check in and also to receive the support, how much they are, how proud they are of you and how much they support you on your journey as well too. The other piece we spend a lot of time about is keeping informed. Are you up to date with the changes at the facility you're in? Do you know the policies and procedures? Just let's think about PPE. It seemed like there for a while, every other day, CDC was coming out with a new regulation. How long can I use this mask? If I don't have this, I can use this. And so we tried to maintain that. Then you add the licensure piece on top of that. We were getting calls in. How long is my license good for in this area? I know I got a special a grant, permission to come into the state. How long is that good for? So we were putting all of that together and helping them as well too. But in our conversations, one of the things I always talked about is make sure you check in on yourself. Look in the mirror and say, gosh, I need a break. You know, we want to be the hero. We want to do all of it as we can, but it comes a point where we need to refuel our tank and to put the fuel in so we can give back again too. So all of this is what I call the resilience in this post-COVID time, but also not just healthcare professionals, but in a very like way, the facilities, hospitals, clinics, they're all kind of doing this debriefing, kind of looking at these lessons learned. What could we do different? How could we do this better? How can we put the playbook in for the next crisis that we're more prepared? And here at Cross Country, we're doing the same thing. We want to learn from our past and we want to grow into the future as well too. So we want to do all of that as well. And we want to nurture that relationship and we want to help in those times as well too. So just a few tips for us as we think about this whole experience that we have went through. And again, we welcome the input to come our way, the suggestions, because it's a living document that will continue to live and breathe as we work through this process as well. So what we want to do now is we really want to hear from you and your questions as well, and to field some of those and some of the things that have come in the past as well too, to kind of address those. So you understand that we are listening and paying attention as well to all of you. Now, this is the point where we really want to have you put into the comment section. And why? Because at the end, we are going to select a winner, and the winner will receive some nursing items from us, and we will be selecting that winner at the end of this session. So Wendi, Marisa, you have a question for us?
Yeah, I'd like to get us started with something that I think we're hearing a lot from travelers or potential travelers, and that is this a good time to be a traveler for the first time? I've been thinking about going. Should I go now? And I think the answer to that really depends. It's definitely a difficult market. Getting your first assignment would be trickier today, perhaps, than in the past. There's an opportunity to work in your region or local market on a contract. So that's something that can be offered. I think it goes to the amount of experience that you have, that flexibility, and what's really driving you. So I think having good conversations with recruiters that you trust, talking to them about why you want to go and what you hope to achieve would allow them to partner with you and to collaborate for, what's the best outcome. We certainly are seeing first-time travelers jumping into the market right now. We're also seeing people, to Marissa's point, taking a pause and saying, you know what, I'm going to slow down for a minute and really reconsider what I want to do. And I think it really comes down to those honest conversations with people that you trust, both your family, your peers and colleagues, as well as recruiters within the companies that you're working with, to understand what your options are and how you want to take advantage of them. I think the other thing I just want to comment on from something that you said, Hank, is the amount of support between travelers, for travelers, between staff and travelers at the highest point was remarkable, really incredible. And for a non-healthcare professional to watch the respect that nurses received during this time, really all healthcare professionals, so long overdue in many ways and so warranted. So for me, I just want to say thank you to all of you. It's awesome to have the opportunity to connect with everyone here, but to say thank you for all that you did and all that you continue to do.
Thank you, Wendi. Appreciate those comments. And I too, been a nurse, let's just say a long time. I won't tell you how long, but a long time, and certainly been through a lot of different and challenging experiences. But certainly, as it's the year of the nurse, what a year it was. What a year of unity for us to come together. And certainly makes me proud to say that I am a nurse, and to have had the opportunity to listen to the stories, to be the person that people could vent to, cry and scream and do what they needed to do, but to also know when they got done, they would go right back and they'd go right back and do it again. As I said, when we talk about the heroes always run towards this, and all of you that went there. And and we talk about nursing, but I would be remiss if I didn't say about all the support within the hospital system. It isn't just the nursing, it's all the other heroes. As we know, it takes a whole village to keep the team moving, and how dependent we are on all of those ancillary services, all the support services, always keeping in mind of the patient and doing that as well. And when you stop to think about what they have accomplished, as I said, many of you were not only doing your professional job as a healthcare professional, but you were also the family. You were the lifeline out to the family. And when you were holding the phone or the iPad or the tablet, and you were having the conversations with the family, you were keeping them informed, and you were the ones that were there holding their hands, whether they're taking the last breath. Some of you shared the stories of how you were putting the phone or the tablet there so the priest or the rabbi could say their final words, give last rites during this time as well too. So all of that does certainly take a toll, but it's our time to come together to celebrate and most importantly support each other. And I think it just shows what we can do as a profession, and no wonder that we are the once again the most trusted profession in the world, because think about it, lives are in our hands and the decisions that all of you make as well. So Marisa, I'll go to you for the next one.
Yeah, I encourage everyone that's on, we're here to answer questions, provide feedback, and have some dialogue about what's on your mind. So I think one thing for me also as a nurse, that was, I think, impactful to our profession as a whole was really our ability to, leverage the executive orders so that we could get nurses to the right places at the right time, right? So there are many non-compact states out there. And so during this pandemic, we were able to leverage the executive orders to get nurses to states that are currently not part of the compact license process. So for me, I think that, again, moving forward, looking at opportunities for our profession to have a more national license, as well as for anyone out there today that may have a compact or holds multiple. I know my licensure is in non-compact states. If you're interested in traveling to a state that is a non-compact state, today would be the right time to be able to really look at and explore your opportunity to receive reciprocity in those states. I think that, again, we don't know what the fall or winter or spring will bring. So I would encourage those to really look at their licensures and explore the opportunities so that when there is a order out there or a new need and you're interested in traveling to some of those states, that you're able to do so, for sure.
I agree with you, Marisa. It's so important to have that availability and flexibility as well. Again, on behalf of Cross Country, I had the honor when this came up to for compact state here in the state of Florida to go to speak in front of the House of Representatives. Why it was kind of unnerving. It was exciting as well as to speak on behalf of the profession of nursing as well. And then one other question, and I'm going to kind of ask Wendi to help us with that. And the question is about people that want to travel together in groups, because sometimes they're afraid of going alone. I've never done it. It's if I can go with Marisa and Wendi and the three of us can go together, there's power in numbers, there's comfort in that. Is it possible, and what does that look like?
Yeah, especially now, right, Hank? I mean, there's never been a time that having a cohort or a buddy or your BFF with you made more sense. So it's certainly possible. I think it really comes down to flexibility. If there are two of you that want to go, finding two jobs, moving on them quickly, and getting offered in those opportunities takes a little bit of finesse. You probably want somebody to guide you through and look at hospitals or hospital systems that use a lot of travelers, so that there are multiple opportunities, perhaps two facilities in the same city versus the same hospital. But it's absolutely possible today. It always has been, and it probably always will be. But I can't, again, I can't think of a time that it probably was more important for the healthcare professional to have somebody to lean on, especially when you're, going into a new environment that's unknown with all of this happening.
I certainly agree. Thank you for those comments as well. And one last thing I want to do before we get to the winner of the gift, I guess we can say, is that I really want to reiterate again that during this time, the support that we need to be providing to each other, and the encouragement that we need to encourage as well too. So much of the debriefing has went on, and when we have those challenging, difficult patients and situations and environments, it's always good to come together as a team and debrief, to support, encourage, and to tell the story as well too. So one of the things I think that we need to do in this year of the nurse is to be the nurse to our fellow nurses, if you will, to allow them to share the story, to talk about the difficulties, the challenges that are out there as well too, and to be that support person for each other. It's so important on a daily basis, but even more so during this time of a crisis that really was going on all across our nation, and is still going on today as well too. And taking time for that emotional, physical, psychological, and spiritual time, whatever it takes for you to recharge. Everybody's different. What works for Wendi doesn't work for Marisa, and what works for Marisa may not work for me. And so we all find that, if that is getting away, if that's exercise, if that's reading a book, if it's spiritual and prayer, if that is just having meditation, whatever that is, find out what works for you and have that mindful moment that you can recenter and help during that time as well too. As we've mentioned, and each of us mentioned in our own way, the future is uncertain, we know. But one thing that we do know, that nurses will be there no matter what that outcome is, because that's who we are, that's our calling. And there's a great deal of comfort there for us as well too. So to be that support person is really going beyond that friend. Nurse to nurse, we know what that means. We know how important that is for us. But most importantly, who benefits from that really are the patients that we care for each and every day. So any final closing comments from Marisa or Wendi before we go to the drawing?
No, I just want to thank everyone for their time. We appreciate you being here, listening to sort of our what inspires us, how you've inspired us, how you're our heroes, and to thank you, really.
Yes, and Wendi?
I was just going to say, if you have something that you want to ask that you weren't willing to ask here, or that comes to you later, please feel free to reach out to any of us. We'd be more than happy to engage in that conversation. What you think and what you say and what you do is what drives us to be better. So don't hesitate. We're here. Well
said. And I want to thank Marisa and Wendi for joining me today as well too, and to have this opportunity to talk rather open and frank about what we have learned from that. And so I want all of you to know that it doesn't end here. It still will continue because we have still lessons to be learned, and we will continue. As I said, the document that we're putting together is this living, breathing document as well. And we're partnering with those facilities across the United States to talk about what did we learn? How could we do different? How can we improve? And the same I'm going to encourage each of you to do as well, too, to think about it from a personal way, but also in a professional way as well, too. And as Wendi mentioned, we're here for you. We are here to help. We're here to assist. I have a team of clinical experts that's out there helping each and every day. And it really is satisfying when we know that we can impact the patients' lives in what we do, but also support all of you and listen to you. So we're here for you. So we have a clinical hotline that's always there 24/7, 365 with a clinical person on call all the time as well to assist as well. So there's nothing more important than we do than it is touching the patients and the lives that we touch across this country each and every day, the thousands of people. And, we all know that it isn't a document. It's not a click of a mouse. It's not a form that's done. It is really about the patients that we provide care to across the country, and so proud of what we do and the care that we can provide across this nation. So with no further ado, it looks like the winner for today is Dan Nadell. So Dan, we need to get some information to you, from you, so we can reach out to you and get that information sent to you. And so once again, on behalf of Cross Country Healthcare, the executive team, we are so excited and so happy about this event today. And we also look forward to future ones as well, too, as we talk. So Dan, if you can reach out to us and get us that information, you can go into private chat if you want, so you don't have to share it with everybody, but we'll get that information to you as well. So once again, on behalf of Cross Country Healthcare, thanks everybody. Chat with you soon. Be well, be safe. Thanks
Bye.
for everything that you do. Bye-bye.
Have a great day, everyone.
Bye.
Thanks.